Hey everybody, we are Team 13, the Thirst Responders, with Anthony Pastor, Rahul Pulagurtha, John Panola, Vishal Suresh, and Peter Jolly. And today we're going to be discussing a solution to monitor and track hydration levels of sick individuals that can specifically be used for cases where dehydration is caused by irritable bowel syndrome. The most important part of our solution is creating a device that allows you to quantitatively and objectively measure your hydration levels. As a comparison, if you are sick and think that you may have a fever, you can use a thermometer to take your temperature to produce a quantitative result. Can this idea of a thermometer be applied to hydration, and what are the implications of being dehydrated in a medical sense?
Irritable bowel syndrome with diarrhea, or IBS-D, affects over 20 million Americans and is characterized by frequent diarrhea, bouts of abdominal pain, and sporadic fluid loss, all of which can place patients at significantly higher risk for chronic dehydration. Now, dehydration itself presents with early warning signs such as dry mouth, headache, dizziness, and fatigue, but these are rather common symptoms and not at all unique to dehydration, which, if left unmanaged, can progress to serious complications such as kidney failure or hospitalization. Case in point, over 500,000 Americans were admitted to a hospital in 1 year alone, primarily due to dehydration, which in that same year resulted in over $5 billion being spent. In the human body, dehydration triggers several compensatory mechanisms. Osmoreceptors in the hypothalamus signal thirst, kidneys reduce urine output, and hormones like antidiuretic hormone and aldosterone work to conserve water and sodium. However, these internal mechanisms aren't always enough for patients with ongoing fluid loss, such as is seen as IBS-D. Thus, there is a need for outside intervention to prevent this issue from persisting.
As we mentioned earlier, our scope is IBS-D patients. Typically, these patients' minds are preoccupied due to excessive fluid loss, and they're not actively focusing on hydrating, and that's where the need for a hydration tracking device comes in. When making this device, we're considering the following criteria. The device should monitor hydration levels continuously. It should send timely reminders to the user. It should be easy to use and affordable. And some measurable outcomes we have is that the device needs to be above 90% accurate. The cost of the device is under $200, and the speed of testing should be under 30 seconds.
The market for dehydration monitors can be split into three primary subgroups, the first being clinical. There is a need for dehydration tracking in hospitals, which is shown by the fact that there are roughly 518,000 hospital admissions per year where the primary diagnosis is dehydration. There is also the market composed of athletes, which is to whom the majority of existing solutions are marketed, with companies such as Nix filling this space. The final group is composed of individuals with conditions that cause dehydration, focusing specifically on IBS. We believe this market is fertile ground for a new solution, as there are no existing solutions specifically marketed towards sick individuals. Shown are two estimates for the market size of the IBS population. The top-down estimate is a lower bound, as we expect the IBS population to overrepresent within the total market. The bottom-up approach uses the estimated cost of $200, which is in line with existing solutions, to get an upper bound of $408 million.
The existing solutions we found were the Hydrotrend test strips, the MX3 hydration analysis device, the Spectraphone, and the Nix hydration biosensor. The test strips are an affordable way to check hydration by using a urine sample. The MX3 hydration analysis device uses a saliva sample and a digital reader to track hydration. The Spectraphone is a non-invasive device that uses light-based sensors to monitor hydration in real time. And finally, the Nix hydration biosensor is a wearable sweat sensing patch that provides hydration feedback during exercise.
The four metrics for evaluating the existing and emerging solutions were test accuracy, cost effectiveness, ease of use, and speed of results. Test accuracy was affected by factors such as potential human error, like in the Hydrotrend test strip. For cost effectiveness, the devices ranged from as little as $15 to several $100s. Ease of use was a qualitative rating based on the convenience and how readily available each device was for use. Lastly, speed of results was another important metric based on how quickly the test could provide feedback to the individual, most of which only took a few seconds. The gap analysis was conducted using a Pew matrix, which evaluated each existing or emerging solution based on the metrics from the previous slide. There was a relationship between test accuracy and cost effectiveness, as more accurate devices were generally more expensive. None of the solutions were ranked negatively for ease of use or speed of results. Based on this, we were able to identify that there's a gap and a need for cheaper, accurate hydration monitoring devices.
So this is our proposed device. It is designed like a smartwatch, which can be worn on the lower or upper arm. It has an adjustable strap to accommodate most arm sizes. It has two electrodes to measure the skin capacitance in real time. This continuous sensing lets us detect both subtle fluid losses and rapid dehydration onset far earlier than traditional spot checks. A low-power microcontroller translates raw capacitance data into an actionable hydration metric, and Bluetooth connectivity syncs to a companion app for trend analysis and personalized reminder settings. We've paired this with haptic pulses and color dot LEDs so alerts reach you without your phone. The enclosure is water-resistant and ruggedized for daily wear and environmental changes. In short, our design marries medical-grade sensing with consumer-grade comfort and connectivity, bringing proactive hydration management right to the patient's skin. So as Tony mentioned earlier, our focus is IBS-D patients who often experience unpredictable fluid losses and struggle to stay hydrated dealing with their symptoms. To meet these needs, our device must do a few things. One, continuously monitor hydration via skin capacitance, ensuring real-time detection of changing fluid status. 2, send timely reminders through haptic feedback and app notifications so that patients can take action even when they're distracted. 3, it must be intuitive and affordable with a one-button interface, minimal setup, and a target retail price under $200. It must be accurate, having a greater than 90% correlation between capacitance readings and clinical hydration markers. It needs to have low latency within 30 seconds of activation. Form factor must be under 50 grams, adjustable to wrist circumference between 140 and 220 millimeters. The battery life must be at least 24 hours of continuous monitoring within a single charge. And these specifications directly align with our consumer needs, delivering reliable, immediate hydration support and a user-friendly package.
We believe our proposed device is a feasible design project for the fall semester. It tackles a real clinical need that can be extended to other groups if implemented successfully, and the concept is rooted in strong physiological principles that fit in well to the scope of one semester. While there are moderate technical challenges like sensor calibration and wearable design, some team members have created wearable sensors this semester in junior design, and others have extensive software coding experience. So we believe this project promises not only technical success, but meaningful healthcare impact, courtesy of the first responders. Thank you.